2014 International Symposium on Garlic is important because it brings together a collection of scientists from all over the world, and they're going to present their findings relative to the research questions, hypotheses, or theories that they were testing with the use of aged garlic extract in a clinical setting.
This is a really nice symposium where everybody here is oriented around one product, the garlic. And we do bring the science into it. And we do bring people in also that can learn from that science and translate that for the consumer.
So we're talking about researchers, whether it's from UCLA or whether it's from Tufts University or other universities in the United States around the world, coming in and saying, look, we're doing real conventional research, using real conventional standard medical methods or research methods, and the results are showing the aged garlic extract does have an impact on lowering cholesterol, lowering triglycerides, on high blood pressure.
And cardiovascular disease, as well as fatty liver syndromes, as well as dyslipidemia, even prevention of diabetes and pre-metabolic syndromes, which are really the plagues of our time. Was extremely exciting to see. But some of what I heard in terms of that very new information had me thinking garlic may in fact be something that can not only treat disease, but also manage some of those genetic predispositions for which we have.
Some people have high blood pressure, another major risk factor for heart disease, or cholesterol's not normal, or diabetes. And when you have these risk factors for heart disease, your chance of having a heart attack goes up.
Blood pressure is a very important risk factor for cardiovascular disease. And there's a continuous relationship between high blood pressure and blood pressure reduction and reducing the risk of cardiovascular health. And at this conference we heard a lot about the benefits of aged garlic extract on multiple components useful for cardiovascular health.
Aged garlic has, in these various studies on people with metabolic syndrome or diabetes, or even the immune effects of garlic, what it allows me to do is talk to my patient in a more relevant way is, why am I giving you this product? And you can't get that without doing the studies, and that's what's really fascinating, what Wakanaga has done with Kyolic aged garlic.
For me, as a talk show host and as a physician, I look at it like the ability to take this information back to the audience and say, look, taking garlic in as a food and or a supplement is really preventive medicine in its purest state.
I think it's important for people in the general public to know that scientists from around the world can talk about what are the latest health benefits of garlic, or in some cases provide possibly some new cutting-edge information about some future applications that we don't even know about yet.
I think there's a tremendous amount of wonderful work going on right now from all around the planet, and we're witnessing it right here at this Garlic Symposium as to where science is evolving as it relates to aged garlic and its use in cholesterol management and diabetes, metabolic syndrome, and even to some degree peripheral vascular disease, hypertension, and that'll continue to evolve. But one thing that struck me was this new research around the mitigation of neurotransmission and stress. The #1 North American-wide silent killer of our day is stress. And how it impacts on our body and ages us, to excuse the pun, faster than we've ever aged before.
But I don't think most of us want to chomp into a clove of garlic every day, and certainly our partners are not going to appreciate that too much. Aged garlic extract has been able to, get rid of the odor, but two, keep the active components.
And Kyolic aged garlic extract is something that you can take as a preventative measure to have better cardiovascular health, better blood glucose insulin functions, moderate the effects of stress, better liver function, and all the other areas. I mean, it's one of those supplements you say, and when you look at the research, you say, it's almost too good to be true.
All these things together increase your quality of life and sort of make you age gracefully and successfully.
But immunity is involved in everything. Heart disease has an immune component, cancer has an immune component. If we don't support immunity appropriately, then all sorts of diseases result.
Probably the last thing I think that's really interesting on aged garlic extract is its immune protective effects for people. So when you think about taking something that protects my vessels, keeps my stress response down so that my vessels can breathe, basically, be more permeable, remodel my LDLs and HDLs so that I'm not in a more predisposed state to plaque, and at the same time help my immune system to stay somewhat regulatory so that I'm defending against vectors and viruses and bugs that I get in contact with. I see aged garlic as being incredibly important and relevant for the struggles that people face today with keeping their health in balance.
As one of the researchers said in there, I think it's just the tip of the iceberg as to what it is that we can actually learn about garlic.
When you look at all of the work just presented here over the last 2 days, you walk away yet being convinced even more that Kyolic aged garlic extract is one of the most important nutraceuticals that is in the marketplace today generally, and in the natural products industry specifically.
Quality of life is everything. If garlic can do all of that, manage stress, lower your blood pressure, improve circulation, and resuscitate your liver from a very toxic environment, then I think, again, no such thing as a panacea, but it comes pretty darn close.